I mentioned before the break GPs. As we go around the country, there is fury that people can't get GP appointments. The online, the Zoom consultation suits some working people who need repeat prescriptions or things like that. But for many others, and particularly I think for those in the older end of the population in this country, they just don't get it. They actually want to go and see somebody. Now, a government-sponsored report now tells us that 60% of family doctors are found to be working 6 half-day sessions or less a week. Indeed, by lunchtime Friday, only 50% of GPs are at work. And I think these are numbers that are going to enrage people. I don't understand why this is. And I bet you at home don't understand it either. Well, perhaps somebody who can help us with this is a GP from Middlesex, Doctor Mo Khaki. Dr. Mo, good evening.
Hi, good evening, Nigel. How are you?
Hello there. Nice to see you. Now, please tell me, there are a lot of very, very unhappy people out there. They've grown up with the National Health Service. They've grown up paying their tax, their national insurance, and they see as one of their basic rights in modern civilized Britain that they can go and visit a general practitioner. And now they can't, or it's increasingly difficult for them to do. And Mo, when you see something like this, that's, and it's a government, and maybe you tell me it's wrong, but it's government research suggesting that GPs work a 3-day week. Can you understand why the public are falling out of love with GPs and the NHS?
Yeah, certainly. I mean, I think it's a really challenging time, isn't it? And I fully sympathise with people who are trying to get appointments, trying to see their GPs and making it very hard for them. I think one of the things that we know is that GP surgeries are mandated. They have a contract. They can't do anything about this contract. They have to offer a certain amount of appointments. They have to see a certain number of patients. So there's a distinction to be made between how many appointments are available and how many doctors are filling that and how they're filling their schedule. Regardless of where you are in the whole of the UK, your surgery that you go to will have a certain number of slots they have to offer. And so those appointments have been there from the beginning of COVID till the end. The only thing is that they've changed the manner. And I think this is the bit where people have found some challenges. Some people, as we've spoken about on previous shows with yourself, have found the face-to-face appointments, they really miss them. Some say, do you know what, this works brilliantly for my lifestyle. But I take what you said. I think the elderly particularly are the ones who we're finding prefer to see people face-to-face.
Mo, look, I accept that there are, for a lot of busy people, self-employed people, etc., who want a repeat prescription. I accept that 1 minute on Zoom does the job, suits them, suits everybody. I get that, and I think that's a factor within the NHS that perhaps can stay, because that works for some people. But for the majority of people, they're not just frustrated, they're angry. And you talk about challenges, but I don't think people sitting at home, or people that we've met with the Farage at Large tour around the country, they don't want to hear words like challenges. They want to hear about solutions. And you say, well, a certain number of slots are allocated. Well, presumably the answer here is there are not enough slots being allocated. I want to know, Mo, why GPs who are well paid, they certainly have been ever since the Tony Blair deal 20 years ago, why are well-paid GPs at a time when we have a massive, massive health backlog in this country, why are they only working a 3-day week? That, for me, is the question.
Sure. I think, coming back to your first point, I think it's really interesting because I love this sort of reductionist approach of a 1-minute phone call for prescriptions, etc. I wish it was that easy. I wish it hadn't taken me 11 years to qualify as a doctor and a GP. Anyone could have done it, of course. The phone calls are triage calls done by experts who are able to assess things very quickly. And of course, what we found was throughout the pandemic, whilst access and seeing people face-to-face was a pain point, we, of course, found that sickness and those things from the outer areas, not COVID, remained well and patients were looked after. I think if we come back to the point regarding appointments and accessibility, I fully agree with you. I mean, I'm someone who shares your concern and everyone's concern. I wish there was an ability for us to have more appointments and more doctors to fill those appointments. But I'd love to come back to kind of what happens on those days you're talking about, because those days are not sort of someone coming in, seeing a couple of people on the phone call and then going back. They are telephone calls of triaging maybe 20 to 30 people in the morning. Then there's people you may see face-to-face. So I still see people face-to-face. Then there's home visits. Then there's prescription requests that come in. So not just signing off a repeat prescription, but, questions. Can I have this controlled drug? Can I not? Queries from patients. There's letters from the hospital.
Mo, I don't doubt any of this. I don't doubt any of this. But let me get back to what I think is the fundamental question here. Why are well-paid doctors only working 3 days a week? 60% of them are only working 3 days a week at a time when we have a backlog medical emergency. I'm just asking, why?
Well, I think the question of the 3 days is the key point here. I think the point is that the 3 days are not sort of 3 simple days. They're 3 days back-to-back, 12-hour days. So I think you're coming to say, call it 36 hours after 3 days. It's almost a full week, bar 4 hours. So doctors are working extremely hard. And I think the thing to remember is, along with all of the work the GPs have been doing, they've been rolling out this vaccine program above and beyond sort of their hours. So the evenings, the weekends, particularly primary care, particularly GPs. The reason why we're in this incredible situation where we don't have to wear masks, where we can go freely. Now, those freedoms have come at a price, I think, and I'm sad to say that I think the reason we're in this situation where GPs are probably scaling back a little bit, even though 3 days is still close to a full working week in hours, is because they're burnt out, they're exhausted. They've been working so hard to do all sorts of things. I know for myself, I was working with the hospitals, working in the surgeries, working in COVID hubs, working in COVID outreach programs, working in COVID assessment programs in the evenings, and vaccinating when I had time on a voluntary basis. I wasn't being paid for some of these roles. And I'm not an individual who was on my own. There were so many who were like me doing the same.
Well, look, Mo, come on. If you were a shirker, you wouldn't come on this show, would you? If you were a shirker, you wouldn't come on this show. And you're doing your very best to tell me that GPs are working damned hard and that the 3 days they week are quite long days. The government research doesn't fully back that up, but it doesn't counter it either. It just suggests 6 half-day sessions a week. But I'm not going to argue, whether those half sessions were 8-hour or 6-hour shifts. I'm not going to argue about that. What I'm saying to you is you may argue the case well, but can you understand why members of the public would feel very angry hearing that well-paid GPs are only working 3 days a week?
Oh, absolutely. And I think it's again, a little bit to do with how we frame it. I think well-paid GPs not doing enough is the rhetoric, which is, of course, exciting in itself. But I think the truth is that GPs are working really, really hard. And yes, they're remunerated well for that. I'm not disputing that, but I do think they work extremely hard. And I think the challenge is the same from the public as it is for us. I would love to speak to more of my patients to deal with more of their concerns. I think the first thing I speak to every single patient I speak to is, I've got 4 things and I've been trying to get hold of you for so long and I can't get hold of it. And it breaks my heart. And I will often stay longer, as will so many of my colleagues, add extra slots, call people in.
I don't doubt.
But there is only a finite amount they can do. So I think that's the challenge. It's to do with the funding of the NHS and the way the primary care is supported, really.
Mo, we will, I promise, we will come back and discuss this subject over the next few months. Please, and you're always welcome to come back on this programme and argue your case. And thank you.